Dr. Gavin Parker has had ties to RhPAP for a long time. RhPAP's new board chairperson was introduced to the organization in the early 2000s as a medical student at the University of Calgary when he took part in a post-secondary skills weekend in Hinton and Jasper.
And truth be told, I was probably more interested in the free ski passes and ski day they gave us on the Sunday, and a little bit less keen about the medical skills that we did on Saturday at the Hinton Hospital.
Little did he know the lasting impression this trip would make on his career. At the time, he was planning on going into neurosurgery, but seeing rural medicine for the first time changed his career trajectory.
That kind of became the start of my love affair with rural medicine. I was so impressed at the diversity of skills that the doctors got to engage in on a daily basis, how happy they really seemed, and what a resource they were to their community.
A short time later, he participated in an RhPAP-sponsored physician shadowing program in Crowsnest Pass and Fort Macleod.
I saw my very first surgery as a medical student in Fort Macleod, actually. It was a C-section.
He then took part in the Rural Alberta South Family Medicine Residency Program, or RAS, an initiative that was co-founded by RhPAP along with the University of Calgary. Rural resident physicians are based in Medicine Hat or Lethbridge, but spend much of their time practicing in the surrounding smaller communities. For Dr. Parker, those included Rocky Mountain House, Milk River, Raymond, and Crowsnest Pass. In each of those areas, he lived in RhPAP-supplied accommodations. After he finished his rural residency, Dr. Parker started locuming through the RhPAP-sponsored locum program, before putting down roots and setting up practice as a family physician at the Associate Clinic in Pincher Creek in 2007, where he remains today.
Do you have trouble hearing on this side?
No.
The following year, Dr. Parker was again supported by RhPAP, both financially and operationally, when he did his GP Anesthesia Fellowship in Calgary. In 2014, RhPAP provided financial support for Dr. Parker to take a month-long training program for cardiac stress testing at the Mazankowski Heart Institute in Edmonton. He now performs 20 to 30 cardiac stress tests a month at his practice in Pincher Creek. Since 2013, he has also served on the RhPAP Board of Directors. For Dr. Parker, it's an opportunity to give back to an organization that has always been there for him.
An organization that I've been very proud to have had a long association with, that I feel I've benefited from so many different aspects of it, and I'm very happy to keep giving back to the organization in this new way and hope to keep helping RhPAP meet the needs of rural health practitioners and most importantly the rural patients that we serve.